Hi everyone, I hope you're doing well and everything is fine with you. So this video is basically a guide for all those candidates who have cleared the written exam and who are moving towards the practical exam journey. One of the most common questions that pops up in their mind is regarding the home setup, because home setup is very important for the candidates to practice these tasks and simulate an exam environment for them to practice and learn and prepare for this exam. All right. So in this video, I'm going to discuss regarding what is the home setup and what are the instruments and materials that the candidate needs to purchase, and also from where you can purchase. All right. Also, please remember that this is my personal opinion and the opinion that I've shared with hundreds and hundreds of candidates, most of the candidates who have successfully cleared the exam as well. So make sure that you watch this video, implement the ideas that I provided, and of course, if you can get ideas and information from another source, make sure that you utilize all the information and then make a decision. All right. So we'll get started. The first thing that we have here is the ADC Practical Exam Handbook. And in that, there is a section which is the Practical Examination Information Package. And it says which materials and instruments are available at the examination center. So the ADC has already briefed the candidate and all those who are appearing for the practical exam on what is going to be available to them on the day of the exam. All right. So make sure that you read this first, because a lot of times we see candidates, they just start looking on different social media here and there. ADC is your main source of information, right? So what ADC tells you is something that has to be taken very seriously. And ADC has this section in the information package where they have detailed on what things, instruments, materials will be available to you on the day of the exam. And this is going to be what is actually going to be available to you on the day of the exam. So make sure that you read through it. I'll go through it for you to understand. So basically, the first thing that they say is an examination kit. All right. So this is the examination kit that will be available to you. Okay. Before I get further, make sure that you understand that this is what they're talking about, the technical day of the exam, because the ADC practical exam is divided into two sections, the technical day and the clinical day. The technical day is where you perform six tasks on a mannequin, three preparation tasks and three restoration tasks. The clinical day is where you have six communication stations and then four technical OSCE station, which basically means rubber dam application, local anesthesia administration, um, extraction, and things like that. So there is a few list of the things that are asked on the technical OSCEs as well. So there are six communication and four technical OSCEs that makes up the clinical day of the exam, and then the technical day is made up of six um, technical day tasks which are performed on the mannequin. All right. So this basically tells you what is available to you on the technical day of the exam. All right. And at the home setup, you'll most likely be replicating the technical day tasks, right? You can also practice the technical OSCEs like fissure sealants and scaling tasks, rubber dam application. So you can practice a lot of technical OSCEs at your home setup as well. Okay. So yeah, the first thing is the examination kit. All right. So this is what is going to be available to you um, on the day of the exam. All right. And then if we go down, it tells you the restorative kit. All right. So this will be basically used for the composite restoration that you have, the anterior and the posterior composite restoration task. All right. And it tells you by name actually what each instrument is. Okay. Now, please remember, it doesn't mean that you'll be using all these instruments. All right. It depends how you would like to do the task. Every candidate has their own way of doing it. So it doesn't mean that all the instruments that they have mentioned in the restorative kit, you need to use them. It's better to get them, have them with you, and see which one works for you, right? And then you have the burrs, all right, and the polisher. So this is the ADC burr kit. So this is what you'll have exactly on the day of the exam. This is mainly used for the preparation task, the crown preparation task, and then you have the endo-axis preparation, and then you have a caries preparation task, right? So this is what will be used on the day of the exam, all right? And this will be available to you on your bracket table. And then you have the names of the birds that they have mentioned here. All right. So you have diamond burrs and you have tungsten carbide burrs as well. All right. And then you have some finishing and polishing, the enhanced polishing disc, polishing point, polishing discs, which are the Soflex disc, and then the mandrel. And it also goes on to say what other things are available. They have mentioned the amalgam dispenser, amalgam well, and amalgamators. Now, please remember, although ADC has not updated this information package on their website, but the amalgam task is no longer asked in the ADC exam, all right? So this won't be available to you, and you don't need to get them for your home practice because the amalgam task is no longer going to be asked in the exam. And then certain other instruments that they have mentioned what will be available to you. And then the PPE, of course. It's always best to do your task with the PPE on. All right. Initially, you can start without PPE, but as you get more confident, please start wearing the PPE so you can replicate the exam environment because in the exam, you'll be doing the entire task as if you're seeing an actual patient. So you'll be wearing the entire PPE. And then the materials they have mentioned, which ones will be available. And then they have mentioned the temporary crown material, Toffel-Mayer matrix bands. So they have mentioned everything. So basically, this all that they have mentioned here is what is going to be available to you on the technical day of the exam. And this is what you need for your home setup. All right. So if you look at from this angle, it looks pretty simple, pretty straightforward. All right. You just need to replicate what they have mentioned in this resource list and have all these things with you so that you can practice according to the standards and the things that are going to be available to you on the day of the exam. All right. And then you have the models and the teeth, of course. Um, you need to have a mannequin, a typhodont model to practice these tasks, right? So that you can use all these things to practice the tasks. So for the model, the ADC uses the Columbia Dentiform, all right, which is PVR 860. And then the teeth, they have different types of teeth, which I'm going to discuss further because that's the most important thing that you need to get because all the tasks that you're going to practice are going to be on the teeth, right? So yeah, make sure that you do go through the ADC practical exam information package, all right? And then, like ADC mentioned recently, that they have removed the amalgam task from period to 2026, which means any candidates appearing for the exam from June 2026 onwards in the future as well. There is no amalgam task that's going to be asked in the exam. And then one other change that they did is the introduction of new teeth. All right. Which means that from now on, the ADC is going to use the platinum range of teeth. So, why this is important for those candidates who are buying the home setup from past candidates or they're getting it from their friends or anyone. Uh, Now, you need to make sure you have to be a bit clever because if you're being sold amalgam and amalgamators and things like that, please, you don't need to buy them. So, don't waste money on that. And then, of course, with the new teeth, because up until now, all the candidates who were preparing for the practical exam were preparing with the old teeth. So when you buy a home setup from someone, you might get those teeth, which are no longer going to be asked in the exam for you in the future. So that's not going to really help you, right? Because you need the platinum range of teeth, which was introduced very recently. Most of the suppliers actually don't have it, and there is a huge backlog of the orders as well. So you need to be very careful when getting teeth from someone, either your friends or past candidates, because they might not might, I'm pretty sure they do not have the platinum range teeth. Because this was just recently introduced, they will have the old ADC teeth, which the ADC is not going to ask the task for in the exam anymore. All right, because it says that the new high performance simulation teeth for the completion of the preparation and the registration task in the technical skills day in the simulation clinic, which means that these platinum range teeth will be used for all the technical tasks, which includes the preparation and the registration task on the technical skills day of the exam. All right. Now, coming on to where you can get these things. Now, one of the most reputed and the one that has been used by me and all the candidates, most of the candidates, I would say, is One Dental. All right. This is based in Sydney, and they have everything that you need for the ADC home setup. Okay. And I'll go through each product. There are roughly 303 products. I'll go through each product that they have. And I'm just in the section of the ADC. All right. And that's what it says, the course products. And you have to create an account on the One Dental website, and then you'll be able to see your course products. All right. So let's go through the products, and then I'll also brief you about the quantity, if you need it or if you don't need it, do you need to purchase it, whether you do not need to purchase it. So I'll discuss all these things with you, all right? So like I said, it will be a bit detailed discussion, so make sure that you listen to it very carefully, all right? Now, if you see here, the first thing that they have is Platinum Endotooth 11 for ADC model pre-order. All right. Now, why it says pre-order? Because, like I just mentioned, these Platinum range of teeth were recently introduced in the practical exam. All right. So, from period 2 2026 onwards, these teeth are going to be followed for the practical exam. All right. So, let's see the first one. It's an endotooth 1-1. So endotooth is basically the access cavity preparation that you have to do, right? On the endoteeth. It's a preparation based task. Do you need the endotooth 1-1? So far, ADC has not asked access cavity preparation on tooth 1-1. So I would say you don't need this one. All right. Endotooth 1-4. Yes, you need this. This task has been asked in the exam for endo-access cavity preparation. So I would say you definitely need at least five of them. All right. Now, always remember that when you're placing an order, you don't need to just order for unlimited practice. Order a few, and then later on, if you need more, just add more to the order and then get them delivered. All right. So you just don't need to get everything in the first go. All right. You can, there is no harm, because then hopefully once you're done with the exam, you can sell it off to someone. But why to go through that hassle? It's better to keep things limited in the start, and then you can order more. All right. So the endo to 1-4, I would say order at least five or more, because you need to practice on this one. Endotooth 4-6, yes, you need this, at least five. If you want more, you can order more of this. This task has been asked in the exam. 3-6, yes, it has been asked, again, five or more. 2-6, or very commonly asked, I would say at least seven or eight of them. 1-6, again, very commonly asked, at least seven or eight of them. All right. And so this was basically the endo access cavity preparation teeth that we were talking about. All right. It's a preparation based task asked in the ADC exam. Okay. So this was the platinum range. All right. Now coming back to this one. So now from now on, every task that you do in the exam will be on the new platinum range of teeth. All right. And these are those platinum ones. Now, if you scroll down, you will see that there is a simple ones as well. Until period 1 2026, this was what was followed. So endoto 3-6, 2-6, 1-6, you don't need them. All right. Because your task is not going to be on this type of tooth. All right. It's going to be on the platinum tooth. All right. So if you see the endotooth 3-6, and then if you go here, you have that in the platinum as well, right? Which is endotooth 3-6, but a platinum version of it. So you need this, but you don't need this. Okay. So this one, you don't need it. This one, you don't need it. This one, you don't need it. All right. Let's go to the next page. Endotooth 1-1, no need. 1-4, no need. Now coming on to the caries section, because caries preparation is also one of the preparation based tasks in the exam. So you need teeth to practice. And ADC, like I said, has introduced new set of teeth, which is the platinum range of teeth, and you will have to order the platinum caries teeth for you to practice. All right. So this one carries to 3-7, mesoocclusal plus disto-occlusal. I would say get at least three of them. 3-7 occlusal plus buccal, you don't need it. 3-6 M plus O plus D, I would say at least order three of them. All right. 3-6 MO. Now, with the caries task, there are certain teeth which are asked more commonly in the exam. So I would suggest that this one is one of the most important. Usually you get a connected MO cavity in the exam. So 3-6 MO, I would say please order at least eight of them. Okay. 3-5 M plus O, maybe two or three for practice. 3-5 D or O, again two or three for practice. 3-5 distal, probably two. You usually get a connected cavity M plus O or MO. You don't get a single sole distal cavity, but maybe two of them for practice would be good. Okay, let's go to the next page. Then you have the caries to 2-6 MOD, maybe one or two for practice. 2-6 MO plus DO. Now, the upper arch, which is the 1-6 and 2-6, they are not really very commonly asked. But because with the new teeth, maybe ADC is going to ask this task, the caries task on these upper teeth as well. So I would say better to order at least um, two or three of this as well, 2-6 MO plus DO. And then you have 2-6 M plus O plus D, maybe two of them. And then 2-6 MO large, you don't need it, all right? The large basically signifies the type of caries, like it will be an extensive caries. Usually with the ADC task, it's not an extensive caries, it's a limited caries, all right? Once you start doing the task, you'll realize that. And then we have all these videos in our course portal as well that will help you. 2-6 M plus O, maybe one or two of them to practice. 2-5 M plus O plus D, maybe one or two for practice. 1-6 MO plus DO, again, I would say two or three. 1-6 M plus O plus D, maybe one of that. 1-6 M plus O. So just to explain to you, what does MO and M plus O mean? MO means it's a connected cavity. M plus O means the mesial cavity is separate, the occlusal cavity is separate. So wherever you see in the caries task, it says plus, it means that they are separate cavities. When you see them as joined, which is like MO and then DO, it means that they are a connected cavity. All right. In the exam, mostly you will have to connect the mesial and the occlusal cavity together. Very rarely you will have separate mesial and occlusal or distal and occlusal cavity. All right. Then you have caries tooth 1-5 M plus O plus D, maybe one or two of them. Platinum caries tooth 1-2, which is a lateral incisor distal. It has not been asked in the exam, so I don't think so. You need it. All right. Now coming on to the simple teeth. So far we have talked about the endo teeth. We have talked about the caries teeth. Now the simple teeth. All right. Simple teeth means that they are for the crown preparation. They are for the composite restoration. And they are for the fabrication of the provisional crown. But that is again, once you do the crown preparation on the simple tooth, you are going to fabricate the provisional crown on the same tooth itself. So the crown preparation and the provisional crown is asked on a single simple one tooth. They are not separate tasks, they're connected tasks. So ADC Platinum Tooth 4-8. 4-8 basically is the wisdom teeth on the lower right side. I would say order two or three of them. You don't really need have any task on wisdom teeth in the exam, but because when you'll be doing the task on 4-7, which is the next tooth to it, you might damage 4-8, right? So for you to make sure that you have adequate contact built up, it's better to order one or two of the 4-8, because once you're starting the practice, especially the beginners, and initially when you start into getting into the practice, you will have this tendency to damage the adjacent teeth, right? So for that reason, just order one or two or 4-8. You don't need more of it. 4-7, I would say at least order five of this minimum. 4-7, 3-7 are not very commonly asked task in the ADC exam, but because 3-6 and 4-6 are so common, are commonly asked in the exam. And then, like I said, mentioned earlier as well, there is a tendency to damage the adjacent teeth. And whenever you want to do the restoration or any task on this teeth on 3646, you want the adjacent teeth to be intact, right? So for that reason, I would say order at least 5 of 4 7. Okay. And then 4 6, please order at least 15 to 20 of this. Very important task, very mm, commonly asked for crown preparation, for composite restoration. And since now amalgam is gone, so it's very high chances that this 4 6 and even 3 6 is going to be asked a lot. Okay. Um, 4 5, you have crown preparation task on this third. So I would say at least order 8 to 10 of this. 4 4, you don't need much, probably 2 3 of them. 4 3, not asked in the exam, probably a few of them. 4 3, 4 2, again, not asked in the exam, probably a couple of them, not much. All right, let's go to the next page. 4 1, again, not asked. You don't have any task on this tooth in the exam, so probably just order a couple of them. 3 8, not needed, just to protect the adjacent teeth, like I mentioned for 4 8. So maybe order a couple of them. 3 7 5, 3 6, again, a very important tooth. Order at least maybe 15 to 20 of this. 3 5 is asked for crown preparation, so maybe at least 8 to 10 of this. 3 4, maybe a couple of them. 3 3, um, maybe couple again. 3 2, a couple of them. 3 1, again, a couple of them, not much. All right. And then you have the upper jaw here, 2 8. Again, one or two, you don't need this. No task is asked. 2 7, again, until now, there has not been any task asked on the upper, but they can introduce this since they changed the teeth, so they might change the task as well. So I would say at least order 3 4 of this. 2 6, again, although not commonly asked. This was a toto where the amalgam used to be asked quite often, but since amalgam is removed, there is a slight chance that they start introducing composite restoration on the upper arch. So maybe order 4 5 of 2 6. 2 5 and 2 4 are important, all right, because you have composite restoration task being asked on this one. So I would say at least order 5 of each to begin with. 2 3, again, an important crown preparation task. All right. So maybe at least 10 to 15 of this. 2 2 is not a crown preparation task, but they ask sometimes the composite, anterior composite restoration on this one. So maybe order 5 6 of this. 2 1, again, a very important crown preparation task. So maybe 15 to 20 of this. All right. 1 8, a couple of them. You don't need, you don't have any task on that. 1 7, I would say 5 of this. 1 6, maybe more. All right. Um, 1 5 1 4, a lot. Okay. Maybe 8 to 10 because you have composite restoration task on these. 1 3, very important crown preparation task. So maybe 10 to 15 of this. 1 2 for composite restoration, maybe 4 5 of this. 1 1, again, an important crown preparation task. So maybe around 10 to 15 of this. Now, please remember that all the values, the numerical values that I've given is an estimate. You can always order more, there is no harm in it. If you don't want to go to the hassle of ordering again and again. So you can order more, and then hopefully once you're done with the exam and if anything is left over, you can always sell it. There are many candidates willing to buy. All right. Let's go to the remaining things. We have talked about the teeth. So let's get to the next section, which is the One Dental ADC student starter kit. So this is basically the mannequin and all the attachments to it. All right. It's not necessary for you to purchase the mannequin from here, but if you do, then One Dental sells the exact ADC mannequin. All right. Then they have the face mask. Of course, you need it, but you definitely don't need to only buy it from here. You can get it from any local supplier as well. All right. Let's go to the next page. Fender wedges. Now, what these are is basically they protect your adjacent teeth when you're doing the crown preparation task. All right. So it helps prevent any damage to adjacent teeth because the damage to adjacent teeth is taken very seriously by ADC. It marks you down severely. So this is basically when you're doing the proximal reduction for your crown preparation, it protects your adjacent teeth while doing it, right? Especially when you're doing the proximal, the mesial and distal. So this is something that helps you with that, and this is something that is available to you in the day of the exam. So I definitely suggest you use it because you don't want to risk damaging the adjacent teeth. Now coming on to the next section, which is the burr. I think they have mixed everything, but I'll go through it. Now, this is one of the burr that they are showing here, but I'll come to the next as we go scroll down. We'll come to the burr kit that the One Dental has, which is the actual burr kit that you have on the day of the exam. So I would suggest purchasing that. All right. Rubber dam, of course, you have a rubber dam task in the exam, so rubber dam is important, but not necessarily for you to purchase it from here. You can get it from any place. This one, you don't need it. ADC dentine enamel teeth, you don't need it. Now, like I said, because ADC has introduced the platinum range of teeth for your crown preparation task, for your endo task, for your caries preparation task. So all the other teeth, you don't need it anymore. Adult X-ray model, you don't need it. Wooden wedges, of course, important. You can get it from here or from any local supplier. PP, again, you don't need to get it from here. Just get it from your local supplier. Much cheaper, much easier delivered to you. All right. This one, you don't need it. Um, this is basically the safety glasses that you need to wear. All right. Whether either you will wear loops or you will wear the safety glasses. Now, for the technical day of the exam where you perform the task on the mannequin, I would suggest using the loops. This will be used for the clinical day where you have the four technical OSCEs. So this is really good one. You can get it from here or you can get it from any other supplier. Face mask, no. Amalgam, you don't need it. This one, you don't need it. Saliva ejectors, you don't need it. Curates, they are important because you need to practice the scaling task at the home setup, right? So you need the Gracie curates for that. I wouldn't suggest purchasing it from here because each one is pretty expensive. Get it from a local supplier, the complete Gracie curate sets, and it will be very easy. But again, like I said, there's no harm in getting it from here. All right. So the reason for this video is to give you an advice. It's not necessary that you purchase everything from One Dental, but most of the things you can also get it from your local supplier. All right. So these are the curates, the composite placement, the restorative kit that we mentioned here. So this is the restorative kit that you have in the exam, right? So you can see all of them here. Either you can get it from here or a local supplier or from past candidate or anyone like that. There's no hard and fast rule that you need to get these things from this One Dental website. All right. Let's go to the next section. Then there's all the restorative kits. If you see here, personal hygiene kit, you don't need it. Lubricant spray, you can have it, or you can just get the VD 40 from your nearby store. All right. This is a lubricant spray for your hand pieces, so you can use them for longer. And then this is, of course, the bench mount, which is basically the mannequin. If you are practicing at your home setup, you'll have a desk where you'll attach the mannequin, right? So the mannequin goes into this, and this hook goes into your desk or the table where you'll be attaching it. Okay. Let's go to the next section. Sports loops. They have one variety. I wouldn't recommend this. I'll show you where to buy it later on. But they also have this oral cavity cover. You don't need it. If you're getting the mannequin, it will automatically come with the cheeks cover and the jaws. A mylar strip for composite restoration. All right. Mirror handle, you don't need it. Mixing tip for ProTem. Of course, when you get the provisional crown task in the exam, you'll be asked to fabricate a provisional crown, right? So they give the provisional crown material and the mixing tips for it, right? So when you get the ProTem material, you will automatically get the mixing tips with it. This is putty, which is used for the crown preparation task and the provisional crown task. So you make a putty index for the crown preparation measurements, and then you make also a putty index, a stent, which you call for the fabrication of the provisional crown. So you can either get it this one or you can get any. It doesn't make a difference, but just get a good quality one so that it makes your life easier and you don't frustrate yourself while practicing. These are composites. You can use this one. ADC has the Gradia A3.5 composite that will be provided to you, as they have mentioned, I think here. Yeah, so that's the one that they're going to provide you, the composite resin for the anterior and the posterior composite restoration task. And for the temporary crown, they have ProTemp 3 MSP. All right. So best to practice with this to make your life easier. But any equivalent good company is also acceptable. For ProTemp, you have the Lexatemp. For Gradia, you have the others like 3MSP. You have certain other brands which are really good. So there is no harm in practicing with them. Okay. Let's go next. Then you have the flowable composite as well. Flowable is usually used for interior composite restoration. Candidates have the tendency to do the interior with flowable and the posterior with packable, because please remember in the ADC marking rubrics for the composite restoration, you don't have any shade matching, right? So, and you don't have any particular type of composite that they prefer. You can use flowable or packable. My personal opinion is posterior, please use packable. Anterior, you can either use packable or flowable, whatever you're comfortable with. And this is one of the crown and bridge refill material. I wouldn't suggest this because in the exam you have the Pro Temp, right? So either use the Pro Temp or its equivalently good brand, which is Luxatemp. Don't get this one. Bond, you don't need bond because you're practicing on plastic teeth, right? So you're not doing the actual thing that you do in your clinics, which is etch and bond and then place a composite restoration. In the exam, the cavity is already prepared on the tooth for you to restore. So you're not preparing the cavity, you're just restoring it. And you don't need to use etch and bond. You are allowed to create certain grooves or slots on the prepared tooth for your composite to stay, because etchant and bonding is used for natural teeth to open the tubules and the bonding to flow in. But these are plastic teeth, they don't have any tubules or anything, right? So you're not using etchant and bonding. One thing the bonding helps you with is one, when you're packing your composite, it helps prevent the stickiness. So you can use it on the top of the instrument that you use to pack your composite. Or secondly, once you are done with the composite, what I usually advise to the candidates is we have these all videos in the demo videos of these tasks. Once you're done with the composite, because you don't have a lot of polishing things given to you in the exam. So I usually advise the candidates to gently dip the micro brush in the bond and run it through the composite restoration, blow the air and cure. It will give you a bit of shine. But of course, you can't do this in Axis, so you have to be very careful with it. Crown and bridge refill, you don't need it. Hand pieces, of course, you can just purchase it locally. You don't need to get it from here. But yes, you need a high speed and a slow speed to practice, right? Mirror handle, again, this is something that you don't need to worry about. Let's go to the next section. Gown, you'll be given a gown to wear in the exam, right? So you don't need to get this one. You can get any local gown. Um, this is the gauze. I don't think so you need it. Sometimes you need it to remove the provisional crown from the tooth. You just hold it with the gauze and take it off. Otherwise, you don't really need it with the home setup. Then these are different types of gloves. You don't need this. You can just get it from a local supplier. Fender wedge, like I earlier talked, this is basically to protect the adjacent teeth while you're doing the crown preparation task. You can either get an assorted pack or just get a few large and medium ones. You don't really need the small ones. A rubber dam punch, of course, with the rubber dam uh, sheets that we saw earlier, you also need the rubber dam clamp holder, the rubber dam puncher, and the frame. So you can get a complete rubber dam kit, all right, for practice. So these are the rubber dam instruments like the forceps, the rubber dam frame, evacuator tubes, no need. Enhanced point, this is important because this is given to you in the exam for finishing and polishing of the composite restoration that you do. So I would suggest you definitely need this, all right? Get at least 10 or 15 of each. These are really important for you in the exam, all right? All these enhance point, disc, and cups. And I think they have mentioned here um, the enhance. Let's see what they have mentioned. Yeah. So you have the enhanced polishing disc and the enhanced polishing point, right? So that means that you have the disc, this one, and the point. So get this at least 10 to 20 of these because you'll use them. Cups are not there, so you won't have cups in the exam. All right, so you don't need to get the cups. Endo Diamond Burr. I'll come to the burr because I want to scroll through the burr kit, which you can purchase. All right, it has all the burrs in one. Mobile dental unit for those candidates who'll be practicing at the home setup. You'll need a dental unit, right? Which is basically the dental unit with the compressor, with the high speed, slow speed connection, and with the suction tube. All right. Those who are practicing at the clinic, you don't need it because you already have it. You just need the materials and the instruments and the teeth and the mannequin, of course. This is the diamond burr again. Burrs, burrs, burrs. Again, this burr. So there are different types of burr that they have individually advertised, all right? But I want to come to the burr kit, which is just basically get the burr kit and you're done with it. All right. I think they have these are the tweezers or the pliers. Sanitizer, you don't need it. Again, burrs, burrs, burrs. These are sheets. This one you don't need it. This is cutting block, you don't need it. Rubber dam sheets, like I said, either get this or whatever you're comfortable with. Cotton rolls, no need. Burr block is there, but once you're getting the burr block with burrs, that will be more than enough. You don't need this tooth patch. Um, this is not needed. When you get the mannequin, it will automatically be there. Forceps, articulating forceps, you don't need it. Occlusion is not checked in the exam like we do in the real patients, right? Your comparison made is made with the contralateral tooth and the adjacent tooth in the exam. So this is the restorative instrument kit, all right. All the restorative things that are present in the ADC handbook. So this is that. Um, you don't need to get it from here. You get it from any local supplier with 1/10 of the price. Or you can get it from here. There's no harm in it. This is the rubber dam kit, all right. Restorative cassette. This is the restorative instruments. Hygiene kit. You don't need this one. So examination kit as well. Then you have ADC dentin enamel tooth. You don't need it. Now this is important, right? This is the ADC set of 15 burrs. So this is the burr kit with the 15 burrs, and they have that thing. Please remember with the burrs, stick to the burrs that are available to you on the day of the exam. That's what you should be practicing on. Don't use any random burr. This is a complete burr kit that you need, and these burrs will be used for different tasks, for the preparation task basically. All right. So you have certain burrs that are for preparation, for crown preparation, for the margin, for the initial gross reduction, and then you have the round burr for the caries preparation for the endo axis, and then you have one of this burr. This is a composite finishing burr. You can use it, not necessarily required, but some candidates rely on it. So it's better to have a feel of it. All right. And then you have the slow speed burrs in round as well. So this is a complete ADC set of burrs, all right? With practice, you will realize you don't actually need all the burrs, but for the starter, please get the entire set of the burr that you have in the exam, which is this one. And then you will know what burrs you are going to use more commonly, all right? From my point of view, the straight cylindrical 1 mm burr, the round burr, the taper burr, and then these pear-shaped burr, flame-shaped burr, tapered straight burr that you have here. These are the most commonly that you will use for your crown preparation, endo axis, and caries preparation. The others are there. It does not mean that if there are 15 burrs, you'll need all 15. No, you will see what suits you. Because, for example, in the crown preparation, you need to create a margin of 1.2 millimeter on the buccal, zero point 0.5 to 0.8 millimeter on the lingual. So you'll be using this burr for that, right? Or you'll be using this burr for that. So you'll have to see what suits you and which burr fulfills the requirement of the marking rubrics for you to achieve it. All right. This one, tooth 4.8, you don't need it. 4.7, you don't need it. Now this one, this, this, and these are same, but this comes in a burr block. So I would say it's better to just get into the burr block, right? So everything is nicely placed in one place rather than scattered around when you're practicing. 4.6, you don't need. 4.5, 4.4. Because, like I said, these are the simple teeth. ADC is not going to follow this anymore. It's the platinum range which we discussed earlier. All right. 434241. No need, no need. You don't need anything on here. Let's go to the next page. No need. You don't need this all of this you don't need. No need. Applicator brush, like I said, for the bond that you will be using to apply. Otherwise, you don't really need this, right? Again, no need. You don't really need this one. You can practice a skilling task on an intact normal mannequin and typhodont as well. Then there are certain prep teeth that you have. You don't need any of these. Prep teeth are basically teeth which they have already prepared, all right? But you don't really need it because these tasks are not asked in the exam, like full gold crown, 3-7 occlusal cavity. These things are not asked in the exam, right? So you don't need any of the prep teeth. You don't need any of this. Don't need this as well. You don't need this as well. This one is basically the model, right? Of course, you need it, but when you're getting the mannequin, sometimes you'll get it automatically with it. If not, then you definitely need this because this is where you'll be um, doing your task, right? This is the typhodont, okay? And this is what you'll be using. So initially, when you purchase this one, you'll get a complete set of 32 teeth, and then there is a screw where you can just remove the teeth, add more teeth to it, all right? And it has a magnetic attachment. Please make sure when you get a mannequin, it has a magnetic attachment because you need to remove these jaws occasionally from the mannequin to evaluate your task, right? You can't have the screw one because the screw one will be, it will be a very hard job for you to repeatedly unscrew and then screw it in. It's better to get a magnetic one, which just fits, clicks into the mannequin. This one you don't need, this all you don't need. You don't need any of this. Again, you don't need these. Now, these are Caries teeth, right? But like I mentioned earlier, they have started using the platinum range of Caries teeth. So you don't need the simple ones. This was what we used to practice the task on. And until now, what the candidates used to do the task on. But they have changed the teeth now. You don't need any of this. You don't need any of this. You don't need this as well. You don't need any of this. The ones that you need, actually, I've discussed it earlier in the video. You don't need any of this as well. Yeah, and then the individual burrs are here as well. This one also you don't need. I think that's it. Um, Now with the burrs, like I said, you get the burr block with the 15 burrs, and then for example, you use a particular burr so many times and it worns out. You can then individually start purchasing, or I would say, get each burr at least a few of them minimum, all right? Like maybe 3 or 4 of each burr, because when you're doing the practice so many times, the burr has a tendency to worn out, and it cutting efficiency is going to get reduced, right? So then you will shift to a new burr. So I would suggest with the burrs that you more commonly used, like for example, the 1 mm flat end burr, at least get 4 5 of them. The round burr, at least 4 5 of them. Then the tapered round end burr, at least 4 5 of them. So the burrs that are commonly used for the task, at least get 4 5 of them so that you have in store rather than waiting for the order if your burr runs out and wasting time. So I would say at least get those burrs which are commonly used, at least 4 5 of them. All right. So that's it. So this is basically that all you need for your home setup. All right. The mannequin, the Typhodont model, and then the instruments, the teeth, and the materials. All right. Where you can get, but before that, I'll just show you certain things. One is that One Dental, like we just discussed. This is the complete One Dental website that I just discussed with you, right? So this is one place where you can get it. All right. There are a few other places that you can get it as well. Please remember that you can also get it from your friends, your social circle, those candidates who have passed the exam and they're selling it. So you can get it and you have this website for comparison, right? So if someone is selling too expensive, you can always just say, no, I can just buy directly from here because they are cheaper here. So you have to work out smartly if you are interested in saving the cost that goes towards the home setup, then you have to work a bit smartly, all right? Now, also, please remember, very importantly, listen to this very carefully. Please remember, you can get most of the things from your local supplier at a very cheap cost because we in our course have candidates all across the world, right? So you will be able to get most of the things at a very cheap price from your local supplier. All right. If someone is working at a dental clinic, they can also arrange stuff at a very cheaper price, right? But certain things, please do not get it from a local supplier. One is, of course, the mannequin and the Typhodont because you need to practice on the teeth, which goes into a certain set or certain type of mannequin and Typhodont, which is the Columbia PVR 860, right? So you need to get that mannequin and Typhodont so your teeth fits into it. Those teeth are asked in the ADC exam. You cannot just randomly practice on any teeth you want. So first is the mannequin, the Typhodont, the teeth, of course. The burrs, like I said earlier, you have to practice on the burrs that are available to you on the day of the exam. So you need to get those burrs. All right. Composite, please, you can get it from a local supplier, but get a good quality or just get one the ADC has mentioned, which is the Gradia A3.5. Provisional crown, you can get it from a local supplier, a Pro Temp or a Luxa Temp one. Maybe you'll get it a bit cheaper from what the One Dental shows. But please get a good quality because if you don't get a good quality composite and provisional crown material, your life will become miserable because with low quality, your work is compromised. All right. And then the enhanced system, which is this one, which I mentioned, the enhance. Sorry, this is scroll down. Yeah, they enhance the polishing disc and the polishing point, right? This one you have to get it because this is what you have in the exam. So don't rely on any random polishing and finishing protocol for composite. You have to stick with what is available in the exam. And what is that? You have one composite finishing bar, you have the enhanced polishing disc, you have the enhanced polishing point, and then you have the Soflex, the round discs from coarse to medium to fine to super fine. So this is what is available to you to finish and polish your composite restoration, and this is what you'll be using. You can't use all the fancy things like I personally have 15 different types of polishing and finishing system in my clinic here in Australia, but that's not what you need, right? And many dentists who are practicing clinicians will have all these sort of stuff with them as well. But you can't practice and learn with that because you're not going to have them with you on the day of the exam. So you will practice with things that you have with you on the day of the exam. And was what you have for composite. All right. So the mannequin, the typhodont, the burrs, the teeth, the composite, the provisional crown, the enhanced system, get it from here. All right. From One Dental. Other than that, the restorative kit, the examination kit, the instruments, the basic things like TOEFL My Retainer, Matrix Band, all these things you can get it from your local supplier. All right. And at times you will also notice that certain candidates who have passed the exam and who are selling their home setup, they will sell everything in bulk. So you can just get it from them as well, rather than picking and choosing yourself, which is not really very hard work. It requires a bit of effort to go through different websites and get them. So it's up to you. You have to work smartly. You've cleared your written exam. You're smart enough to work your way throughout with the practical as well. Okay. Um, yeah, so this is basically what we discussed so far. Now, like I said, One Dental is one place. The other very common and very reputable and a very efficient one is Nevada. Okay, this is based in Mumbai, India, and they have all the things that I just discussed with One Dental. They have all the things here as well. You can either get it from here as well. Maybe the price will be a bit cheaper, but for those living in India, it makes a bit of sense because they might receive the delivery much faster, and when they want to reorder products, they might receive it a bit faster. So you can also have get it from Nevada. So it's basically what you have in One Dental, you also have at Nevada as well. Okay. The other thing for candidates who are going to practice at the home setup at home, um, many of my students that I have mentored who have cleared the exam, they used to get this one from the ADAE, which is the portable dental unit. So this is a portable dental unit with a built-in compressor. It has a compressor, it has a slow speed, high speed, the triple syringe, and suction tube. So this is a really good one for those candidates, and it's very silent as well. So you can buy this and practice at home as well, rather than buying the dental unit separately and then compressing separately. There is no harm in doing that. Okay, you can perfectly well do that as well, or you can get this portable dental unit which has everything in one. Okay. And then this is the other type of the portable dental unit with built-in compressor, but I think this is a bit fancy one with the curing light and things, all the other things. You don't really need to get this one because you can just buy the curing light separately. Okay. With the Yeah, so this ADA also has dental ADC dental exam products. So you can see they also sell the mannequin, which I think a lot of candidates have used and they're quite happy because this is a Columbia PVR 860 as well. So I think this will be fine for the mannequin. Okay. Please don't get these teeth, okay, because these are not the teeth that was asked in the exam. You can get the compressor and the mannequin if you want from them, but not these teeth, okay? Um, Then you have the loops. I have had a lot of candidates who have got these loops. Now, those clinicians, those dentists, those candidates who already use loops when they're doing their clinical dentistry, they can just use that loops for the exam as well. But those who are new to this, I would suggest buying something simple like this one, the 3.5x one, which is fine, all right, to start with. And then because this is an exam, right? But once hopefully you're done with the ADC, start practicing as a dentist in Australia, you can just go on and get other loops as well. Okay. So this is the other place, which is the ADAE. Okay. And then you have Moi ADC. I think they're also quite reputable. They've sold a lot of stuff. So you can also check the materials and the instruments and everything that I've discussed with them as well. All right. Um, this is Moi ADC Part 2 materials. This is their Facebook page. All right, so you can check with them as well. They sell a lot of things, and a lot of candidates have bought stuff from them. So you can also check and get stuff from them and make sure to ask them that whatever you're selling is compatible with the mannequin and the jaws that you have. All right. So yeah, make sure that you watch this video, read the ADC Practical Exam Handbook, read the ADC Practical Exam Information Package handbook that they have, and basically, yeah, it's not a very tiresome journey to get the home setup, but it's always good to know what you are buying, what you need to buy, so you get a clear picture because the exam, practicing for the exam, doing the task, preparing for the exam by itself is quite tough, right? So you should have a clear idea of what materials, what instruments that you have. So whenever you plan on practicing a particular task, you have everything in ready rather than hassling and then getting or things ordered at that time and then waiting for the delivery. So you don't want to complicate your life in that way. So keep things simple, keep things clear, keep things to the point, straightforward, and of course, whatever I mentioned here, those candidates who are part of our Academy's practical exam course, all the videos, the demo videos, the assessment videos we have is according to the materials and the ADC handbook, whatever instruments, materials that they have on the day of the exam, our videos, everything that we have in our course is according to these materials and instruments. All right. Thank you, and I hope this was very helpful for all the candidates who were sending the academy a lot of messages regarding what to buy, from where to buy, what materials we need, what instruments we need, what burrs we need. So I hope this video helped all those candidates planning to get a home setup and getting their ADC journey started, the practical exam one. Thank you, and all the best.